the JAMA Network.
This is something no one wants to see: blockage of blood vessels in the heart.
If somebody's having chest pain, it generally means that they have a plaque that is blocking more than 70% of the coronary artery. So we call that obstructive coronary disease.
When patients have smaller amounts of plaque, they are diagnosed with what is known as non-obstructive coronary disease.
We were concerned that perhaps those non-obstructive plaques did have a risk for causing a heart attack down the road.
Dr. Thomas Maddox from the Denver VA Medical Center and co-authors examined angiograms of more than 37,000 U.S. veterans over a 3-year period. This procedure can detect obstruction in the coronary arteries. The researchers wanted to see whether patients with smaller blockages had heart attacks or died in the year following their angiogram.
Patients with non-obstructive disease had a 2 to 5 times higher risk of heart attack and death. We haven't been able to see that relationship before.
The study appears in JAMA, Journal of the American Medical Association.
All of these patients, regardless of whether or not they had non-obstructive or obstructive coronary disease, had a higher risk for heart attack and death over that following year compared to patients who didn't have any coronary disease at all.
Dr. Maddox says it might be time to think differently about how we categorize coronary artery disease.
Rather than simply thinking about obstructive and non-obstructive, we should probably be thinking about any coronary artery disease versus no coronary artery disease.
Catherine Dolf, the JAMA Report.